Good afternoon. I'm Madonna Guy and this is David Sheil. And we wanted to talk a little bit about complementary therapies today because people are challenged and people need help. And I always think it's better to have more people in your team of support than less.
Right. And I'd agree with that for sure.
Yeah. And I have so many clients over the years because there is a real divide between medical and naturopathy that these days I have a small group of people that I will refer to, and because I know that they are on the same page for their client. Because my clients are so uncomfortable a lot of the time when they are admitting to someone in the medical field about what they're doing from another perspective, which is such a shame.
Right. Okay. That's interesting.
Yeah, and it's been the case for 30 years. There's been highs and lows, when medically they've sort of been a bit more okay, but, at the moment we're not in that space.
And that's been not improving over time too.
Oh, it's been worsening.
Right.
Yes.
It's interesting because from the perspective of being a counsellor and a holistic counsellor, we're not really touched by that, right? Because and in our code of ethics, we have to work with all types of other therapists,
right,
in a positive way where we can. And again, unless there be some sort of malpractice, but that's often, very rare. And everybody's capable of that in any profession,
absolutely,
whichever side of because there's also some people in the natural world who maybe aren't as ethical as they could be.
Yeah.
We've all heard those stories. And but as a counsellor, I like to fit in between. And as a complementary therapist, I'd like to bridge that gap where I can too.
Yes.
Because my understanding and my personal experience is that because I've had some critical illnesses over time, and it definitely worked better with both for a lot of things. So getting the medical and the naturopathic together.
Yeah.
And because the fact is, if you've got a problem, and especially if it's one of your kids,
yeah,
right? And in my case, it's been that. And it's like, sorry, I want the best of everything.
Yeah.
And that's using both and not saying this and not that.
Yeah.
Because that's not fair to the kid, And so as long as everybody's playing fairly, except...
I think that's not the way the world is.
I know,
there's been so many times over the years when I've had other, even naturopathic practitioners who say, you can't see anyone else while you're seeing me because otherwise I won't know if my treatments are working. And then I don't see that client for 6 months, a year, 18 months or something, and they come back to me in the same place or worse. And then I have to start from scratch. Not that there's anything wrong with that, but the client should have the choice whether or not they're adding someone in. So if you've got a practitioner you're paying money to who's saying to you, don't see anyone else while you're seeing me.
And that happens, well, they're trying to prove their theory, right? Which isn't something you would want to do on your clients. You should know what you're doing already, not trying to prove your theory.
Yeah.
So, but also, then how do you table complementary practice where you're getting medical and naturopathic together and counselling together? Which one is the one curing you?
Yeah, but what if it's a holistic approach and it's the combination that's helping you get cured?
That's right. And so nobody's got any data on that because you can't keep somebody else's records.
Right.
Right. But I definitely do know that there's been because I'm aware of it, there's been, from the medical side, there has been a bit of a negative thing towards naturopaths.
Bit of a negative thing. You're hilarious.
Well, the fact is,
it's not a bit of a negative thing.
So
it's a massive thing.
Okay, so a massive thing. So a bit of information on that. Naturopaths used to be on.
Oh, well, I had health fund rebates for 25 years.
So there used to be a part of the allied health team.
Yeah. And in 2020, I was removed from the allied health team in
not
Australia.
You personally.
No, naturopaths.
Naturopaths.
And, so for 25 years, I was allied health.
Right. And suddenly you're not.
Yeah.
Because of...
And I sort of missed it. I didn't realise. I didn't pay attention.
You didn't notice.
No, I didn't notice.
So it didn't really affect anything.
No, it was sort of funny, actually, because our Prime Minister, ScoMo, was on the TV saying, Allied Health can keep on working. And I thought, oh, good. So I just kept working. And 6 months later, someone said, we're not Allied Health anymore. And I said, what do you mean?
Well, you're not Allied Health. What are you, actually?
I should have taken 3 months holiday.
Oh, that's really funny.
But anyway.
So that was just before the pandemic.
Well, it was during the pandemic. So it was when he was giving that. You remember when we shut down for 6, 8, 10 weeks, whatever it was in Australia? I wish I'd had a holiday like everyone else.
Like January.
I worked my hookers off.
Right.
Yeah.
In the first shutdown.
Yeah, I worked the whole way through.
Right.
In fact, I was one of the busiest people I knew because I thought I was allied health.
Well, you are actually. I mean, what does...
Oh, it's crazy. But anyway, so we just thought, the whole complementary thing really shouldn't be a challenge out there.
Well, complementary was always the way it used to work, because the fact is that for people, sometimes the medical things give them really bad side effects.
Yeah.
But whether it's the drugs, mainly the drugs, what other side effects? But some people don't respond well to their treatments.
Yeah.
And if that's the only option you've got, that's really sad. And everybody knows it's not the only option you've got.
Yeah.
Because,
well, actually, some people don't know that.
Right.
Some people don't know that because lots of doctors say, we have to give you pain management. That's all you can do. So I regularly get people coming into the clinic and they don't know there's another option. Well, in fact, they often say, I know you won't be able to help this, but, and I say, actually, I can.
Right.
And for me, that's a little, I take that as a challenge when someone comes in and they says, I know you can't help me, but.
Okay. What's a good metaphor for that? Saying that, the problem with that is that all therapies, whether it be medical or naturopathic or counselling, we've got toolboxes. Yes. Right? And we've got tools in the toolboxes. Yeah. And the doctors have got blood tests and specialised tests, and then they've got medicines. Yep. And that's kind of how the toolbox works. Yep. Drugs, chemo, radiation, injections. And so if someone's got emotional, they refer them to a counsellor or something, emotional issues. Usually a psychiatrist to put them on medications. Well, but that's a first port of call for most doctors. So no, the GP does those referrals, so yeah. Actually, in Australia, it's something like 4 to 6 minutes. 4 to 6 minutes, and a woman can be put on drugs. Psychologists, you'll get a referral to more likely if you don't have a really serious condition. Yeah. Because they can manage most things. And they all get kickbacks, I think, for, like, you might get a 5% kickback for each referral to somebody in that APRA is their accreditation organisation, and psychologists in that. But the thing is that everybody's toolbox is limited. Yeah. And so when one practitioner's toolbox runs out, the respectful thing would be to refer your patient to somebody with a bit of a different toolbox, like an naturopath. Yeah. Except that doesn't seem to be happening. And that would be complementary. Yeah. Because if I've got a patient in front of me and they need help and I don't have the toolkits, I should refer it to somebody with an alternative toolkit. Yes. It's really just a toolkit. So doctors have that, and naturopaths have a range of herbs and a range of different diagnostic procedures. And also they do things like you do kinesiology, which is more specialised. A lot of naturopaths don't do any hands-on these days. It's been pretty much wiped out the last 10 years. And so their toolkit will be, sort of diagnostics and herbs. Yeah. Which are also they're also effective. And the thing is that some medications don't work with people. Yeah. Because everybody knows if you've got a kid with ADHD, do you know what I mean? They'll try one thing and that doesn't work. They've got 6 things they'll try. Do you know what I mean? Because everything doesn't work for everybody. If you look at their success rates, it's not 80% for everybody. It's this much for this, and then they try them on this one, it's better. And they've got they have to try people on different things as they go. And if they're not looking at diet, they're never going to get anywhere. That's another toolkit. Another toolkit in the natural therapies is nutrition. Yeah. And it's very effective. I mean, because natural weight loss, for example. Yeah. I mean, it's really hard to do weight loss, but if you can get some herbal assistance and, you've got a range of things. And actually, even just with weight loss at the moment, so I'm on the HCG process for a couple of weeks in, and I've lost, 4 kilos or something like that. But it's interesting because now I'm at the kilo where my mum died, so I sort of went back because I'm a crazy person. So I've got written down for the last 20 years how much I weigh. Oh, really? And so I sort of thought, I wonder how much I weighed. So sure enough, I've gone back because I had a look over the last 2.5 years. I've gone back to that weight
once or twice
Mhm.
and slightly less, but within a week I've put the weight back on again.
Right.
And our issues are in our tissues.
Mhm.
And I've actually gone back and gone, right, I've hit the spot where I just can't shift this last kilo,
Mm.
to get underneath that which is interesting to before Mum died.
Well, it's harder as you get older too.
Yeah, but there's something going on there. So I
Mm.
might make myself some flower essences or make a playlist within the bioresonance or something like that specifically for grief.
But so let's back to the complementary idea. Like
Yeah,
complementary, like in this context, is spelt with an I, complementary.
right.
Whereas there's also complementary with an E,
Yeah.
complement.
You're looking good today. Yeah.
The other right. The other way around. And my idea of complementary is that we should be complementary and complementary.
Yeah.
Like as a natural, my goal is to be complementary to all the other types of practitioners that surround me, because if I can't get, say, if I've got a client, I need to talk to their doctor or their naturopath, I need a good relationship with those people, or they won't tell me what's going on.
Yeah. Absolutely.
And so, it's like staying in that complementary position is a really safe thing, and trying to keep as positive as possible with the other practitioners.
Absolutely. Because again, I've noticed over the years, because I'm decades into this, and I notice that some practitioners get really arrogantly from the perspective of, you come to me and just say, I don't like chiropractors. I do, but just say I didn't, and they come in and say, oh, I've been seeing my chiropractor for 5 years, and I go, well, you've wasted all your money there, haven't you? But it's a real arrogance, and lots of practitioners can do that, and it's so
Really?
rude to people. I've heard it so many times over the years. And I have known some things that I know I can do better than other practitioners, but I still don't say, hey, you've wasted your time with those people, because
Right.
everyone attracts the clients to them that they can help. I believe we're all putting out an energetic frequency. So who I'm attracting is the people I can help.
But there's another thing too. Some clients just won't sit with some practitioners who everyone else likes.
Yeah, absolutely.
Because and counselling can be even more like that. If you don't get a good fit with people, you're talking about the deeper people stuff in people's lives and the really sad stuff.
And then you've got to remember, people go home to their partners.
Mm-hmm.
And if their partners ask about things and the partner say something negative, it's really hard for people to get onto a healing path of any sort without the support of people at home.
That's true, actually.
So if you don't have the support, because it can bring stuff up.
I've experienced that. Because I've had counselling myself. I've come. I won't say where I went, but somebody said, "Oh, that's not true. They don't know what they're talking about." And over time, it was like they did, and it was the So that has something to do with people want to change. Often, when they start to change, the people in the environment don't want them to change.
No, they don't like it.
But the reason is because they like them like they were before.
Absolutely.
And sometimes that's for a good reason, but often it's for maybe not such a good reason.
Well, we've often been attracted, as they say in Sleepless in Seattle, my neurosis is attracted to your neurosis, and we've got that joint combination of neuroses.
True.
So you take one neurosis out of the equation, and the other person doesn't know what to do with themselves.
Mm-hmm. And so in couples counselling,
he became Niles in
right.
Frasier. That was nice. Anyway,
I remember that guy.
Yeah. So anyway, we do believe in complementary practice. We're not just ourselves. We're talking about everyone, by the way. We believe that all practitioners should behave themselves and get along with other practitioners, and also understand you can't do everything.
That's right. We've got limitations.
Yeah.
Every toolbox has limitations.
Yeah.
And people should be allowed to freely go and find out even if someone's got something that is really serious.
Yes.
Right. So, and some things we aren't even allowed to mention very much, but sometimes if you get, like Madonna said, people really do, in some conditions, they get just pain medication to die and told there's nothing else, when there are things. Like, for example, if somebody's got that diagnosis and they can't fix it, something really malignant, and then they're sent pain relief and die. Well, the truth is they could get counselling.
The truth is they could see a naturopath.
No, I know that, but I'm going outside the polarized thing.
Yes,
The
yes.
truth is they could get counselling to make them feel better,
Yeah.
even if that's the way. And then they could get some naturopathy and get some herbs to assist their other conditions. Because if I've got cancer, right? And so it's like I do the medical stuff, but then it's like I want more support than that because because it might be for my stress. And so it's like getting some herbs for my stress. It's like, well, that actually will help with the healing process.
It will,
And
because
they
the
found
immune system doesn't function well under stress.
that's right. And the immune system, cancers, like a something like that. It's like the T helper cells. And
Yes,
those sorts of
absolutely. Your
things.
T helper 1 cells are low during cancer.
So therefore, by supporting your immune system, not curing anything,
Yeah.
but you're giving support where it's needed.
Absolutely.
Is that right? Is that ethical?
Yeah, absolutely.
Because there's a funny line there where people aren't sure what to do.
Yeah, and I just don't understand why people wouldn't. Most people don't know there's help there when they've been told to go home and die. They
Right.
don't know they're allowed to go and get help because they have been told that, hey, this is all we can do.
Mm.
Anyway, I've got to go pick up young teddy bear.
Well, that was an interesting conversation. So
Yeah.
there'll be more and more complimentary and spread the idea to not just because in the world at the moment, there's so much polarization, political and this and that. And I think it's a good time to start behaving like more complimentary and more complementary as
Yeah.
people with all our
And
relationships.
what a concept. Let's just be kind.
Let's be kind.
Walk
Okay.
out into the world with love and care.
Oh, that's beautiful. Lovely
Awesome.
work, Madonna.
Okay. See you later, everyone.
Bye.
Bye.